Community Analysis Presentation. The City of Sanford. The objectives are historic overviews, community analysis, prioritize community problems, and global communication issues. Historical overview. In 1837, Sanford was one of the United States military post sites and was named Fort Malone during the Second Florida Seminole War. Settlers built the town of Malonville, which became popular because of its steamboat services. In 1845, Orange County is formed with the new town Malonville as the county seat. In 1870, Harry Shelton Sanford bought the property of West Malonville. The South Florida Railroad built a terminal in Sanford. In 1883, Malonville was incorporated to the city of Sanford. In 1913, Seminole County was formally recognized and the city of Sanford was the county seat. By 1940, the population of Sanford reached 10,217 and a naval air station was established in Sanford. Today, total area of Sanford is 22.96 in square miles. The population is 57,525 and population density is 2,333.4 per square mile. There are many tourism spots which include Seminole County Convention and Visitors Bureau, Historic Sanford Welcome Center, Central Florida Zoo and Botanical Garden, Sanford Auto Train, and Orlando Sanford International Airport. Structure. There are 31 K-12 schools, include 25 public schools and 6 private schools. There are 42 free schools, 26 elementary schools, 19 middle schools, 13 high schools, and 2 colleges, Seminole State College of Florida and Aerosm Flight Academy for those people who want to be a pilot. Also in Sanford, there are 3 public libraries, Seminole State College of Florida Library, Seminole County Law Library, and Seminole County Public Library System North Branch. There are more than 80 churches where people can gather and worship. Sanford Museum reserves historical records and research collections of Sanford. Historic Sanford Memorial Stadium is the home of Sanford Baby Ruth Baseball and the Sanford River Rats of the Florida Hurricane Summer League. Sanford Civic Center provides multicultural community activities and entertainment. Lady A. Dale Aquatic Center provides a place to learn and train as swimming year-round. Sanford Senior Center and Westside Community Center assist seniors activities such as craft, bingo game, or dancing. Low-income housing is 15 subsidized housing projects consist of a total of 2,957 units managed by federal, state, or local assistance. Congregate and homeless facilities are not allowed to exist in the city. There are, however, three facilities and housing targeted to homeless households: emergency shelter bed, transitional housing bed, and permanent supportive housing bed. The population of the city of Sanford was 57,525 in 2014. Median household income was $45,180 per year. Less than high school graduates were 3,694 people among population 25 to 64 old of 29,093 people. Individuals below poverty level, that means making less than $24,999 per year, or 2,962 people, compared to Seminole County 12,374 and national 829,225. People who did not work were 10,484 people among 16 to 64 years old of 34,991 people. People who had disability status were 6,282 people in the past 12 months. Percentage receiving public assistance was 3.6% in Sanford, compared to Seminole County of 2.0% and national of 2.1%. Unemployed persons were 1,459 people among civilian labor force of 26,842 in May 2015. Diseases and health issues. First of all, maternal and child health. No birth weight infants were 349 and very low birth weight infants were 62 among 4,418 live births in Seminole County 2013. The infant mortality rate was 5.4 deaths per 1,000 live births. 80% of the women who gave birth to a low-weight infant said they were smoking during pregnancy. About 14.2% of Seminole County women did not get prenatal care in first trimester. The birth rate of teens between 15 and 19 years was 14.1 live births per 1,000, indicated lower than the national rate of 31.3. Chronic diseases that result in death are cancer, obesity and overweight, heart disease, stroke, chronic lower respiratory disease, and diabetics. Cancer was the number one blame for deaths that caused 31% of all deaths. Injuries and violence categories are included motor vehicle crashes, suicide, and intentional injuries, homicide. The rate of motor vehicle crashes was 12.1, which indicated lower than the national rate. The number of suicide deaths was 61 in 2013. The rate of intentional injuries, homicide was 2.5 deaths per 100,000 that were lower than the national rate of 5.3. Communicable diseases are syphilis, chlamydia, gonorrhea, HIV, AIDS. In Seminole County, the rate of syphilis cases jumped 4.7 in 2012 to 6.2 in 2013. The rate of chlamydia cases also increased from 166.4 to 321.0 in 2009. The rate of gonorrhea cases, however, stayed steady. That was 71.3 in 2013. The rate of HIV/AIDS was downward until 2012, but it went up to 14.6 from 9.1 in 2012. The city of Sanford has 35 parks where kids can play and families could have fun. Seminole Town Center is a shopping mall in Sanford. It has 7 major stores: Sears, JCPenney, Macy's, Dick's Sporting Goods, Burlington Coat Factory, and Dillard. The city of Sanford has several bike or hike trails. The Sanford Riverwalk Trail is on Sanford's north side of Lake Murray shoreline and is one of the most scenic paved trails in the county. The Riverwalk extends along US 1792 about a half-mile to Mellonville Avenue in historic downtown Sanford, featuring views of Lake Murray all along the way. The Sanford Police Department has 131 police officers and 17 civilian employees who serve to protect the Sanford residents from the crimes within the community. The police department consists of a traffic unit, canine police dog unit, investigation unit, drug abuse resistant education, school resource officers, and crime prevention community officers. The fire department has 3 stations. The fire department provides services that are fire risk, emergency response, Tower 31 for rope risk, trench risk, and restricted space risk, EMS bike team, citizen CPR classes, formalized station tours and on-site displays, smoke detector program, automatic defibrillator, walking blood pressure checks, juvenile fire setters program, child passenger safety program, bicycle helmet offenders program, and kids safe place programs. Public workers are currently Mayor Jeff Triplett, 4 district commissions, city attorney, city manager, city clerk, and deputy city manager, 9 directors who are charge of each department, communication officer, fire chief, and police chief. The area concerned are: first, surface water quality that are monitored by water quality monitoring sites, 1 site located in Lake Murray and 3 others located on Lake Joseph. The rating for Lake Murray was fair, however, for Lake Joseph was poor. Groundwater is a main potable water source in Sanford, and the city tried to improve the use of reusable and conserved potable water. Flooding plan. Sanford is categorized by national flood insurance rate maps as flood zone X, designated least likely to have a flood. Soil, soil erosion is not a problem for Sanford, but the state still monitors, and mineral resources are also monitored by the city. Hazardous wastes are managed by the Soil Waste Department of Seminole County and the Central Transfer Station, and the brownfield areas in Sanford are designated at north to south along French Avenue, Orlando Drive by US 1792. The city of Sanford works on making an ecological community in developing process of the city. Health-related resources. Central Florida Regional Hospital is a partner of Hospital Corporation of America, the nation's largest healthcare network with more than 163 hospitals. The hospital dedicated to heart care and rehab in the Sanford area, providing a full service and a Level 2 trauma center, and has 226 general medical and surgical beds. Florida Department of Health Seminole County Health Department in Sanford performs the essential public health services. The Health Department provides environmental health, clinical and nutrition service, wellness programs, community health planning and statistics, emergency preparedness and response, and infectious disease services. There are two locations in Sanford, one for environmental health and the other one for clinical and nutrition services. The Central Florida Family Health Center is a private, non-profit health organization serving people who are low income or uninsured. Sanford Central Care is a urgent care facility that assists with instant access to licensed physicians and offers either walk-in or appointment. Healthcare and Rehab of Sanford provides skilled nursing home services and a for-profit corporation. More than 15 home healthcare facilities are available in Sanford and provide their services as either private duty home care or medical certified home health. Healthy People 2020 Objectives. Access to health service. For improving access to comprehensive, quality healthcare services. Substance abuse. For reducing substance abuse to protect the health, safety, and quality of life for all, especially children. Sexual transmitted diseases. For promoting healthy sexual behaviors, strength community capacity, and increase access to quality service to prevent sexual transmitted diseases and their complications. Older adults. For improving the health, function, and quality of life of older adults. Cancer. For reducing the number of new cancer cases as well as the illness, disability, and deaths caused by cancer. Family planning for improving pregnancy planning and spacing, and preventing unintended pregnancy. Environmental health for promoting health for all through a healthy environment. Nutrition and weight status for promoting health and reducing chronic disease risk through the consumption of healthful diet and achievement and maintaining of healthy body weight. Injury and violence prevention for preventing unintentional injuries and violence and reducing their consequences. Government and public policy. The Sanford City Commission consists of Mayor Jeff Triplin and 4 commissioners. District 1 for Art Woodruff, District 2 for Dr. Velma Williams, District 3 for Randy Jones, and District 4 for Patty Maher. Mayor's Youth Council is assembled with 12 students who live and attend one of high schools in Sanford. The mission of Youth Council is to support regular and active civic engagement among youth. Sanford City Commission regular open meetings are scheduled on the second and fourth Mondays at 7 p.m. in the Railroad Depot Conference Room located on the second floor of City Hall. Here is useful website for about the city of Sanford, sanfordfl.gov, and check Facebook for photos and videos. Seminole Government Television is the government access television and educational access cable television channel in Seminole County. Now we are looking at the overall Sanford community problems. First, on cancer. The cancer screen rate dropped from 2007 to 2010. Blood stool tests dropped from 24% to 15.5%. Sigmoid colonoscopy dropped from 55.7% to 53.3%. Prostate cancer screen test dropped from 79.6% to 70.2%. Digital rectal exam dropped from 64.5% to 46.6%. Mammogram dropped from 63.2% to 50.5%. Clinical breast exam dropped from 68.5% in 2007 to 59.3%. Pap test dropped from 69.8% to 56.3%. 25% leading cause of death is cancer, especially lung cancer and breast cancer in Seminole County. Only lung cancer and cervical cancer met the Healthy People 2010 targets, not colorectal cancer, breast cancer, prostate cancer, and skin cancer. In U.S., cancer is the leading cause of the death. Number 2, overall Sanford health problem is maternal and child health. For 2013 data in Seminole County showed low birth weight births were 349 of 4,416 live births. Very low birth weight births were 62 of the births. Preterm births were 13.1% of births. Infant mortality was 5.4 deaths per 100 live births. Women who did not receive prenatal care were 14.2%. Women who reported smoking during pregnancy were 8% of the births. Teenage pregnancy rate was 14.1 per 100 teens. Blacks were higher rate for low birth rate, infant mortality, smoking during pregnancy, teen birth rate than whites. The maternal and child health is associated with existing health conditions, age, access to proper preconception and in the conception health care, and poverty. Number 3 and number 4 are environmental health and older adults. Surface water quality rated for Lake Murray was fair, but for Lake Joseph was poor. Brownfield area in Sanford were designated at north to south along Prince Avenue, Orlando Drive by US 1792. The environmental health is associated with outdoor air quality, surface groundwater quality, toxic substance, and hazardous waste, homes, and communities. Infrastructure and surveillance, and global environmental health. Older adults over 60 was 6,807 among 55,471 population in 2012. The population is increasing in Sanford. National data show 1 out of 3 older adults fall every year, and 1 to 2 million older adults are harmed or mistreated by family member or caregiver. Older adults' health is associated with health service, quality of life, injury prevention, and caregivers. Number 5 is injury and violence. Overall age-adjusted mortality rate from motor vehicle crashes was 12.1 in Seminole County in 2013. Blacks were 21.8 and males were 14.9 compared to females of 6.4. 61 suicide deaths were in 2013. The number increased from 54 per 100,000 in 2012. Whites are higher than blacks, and males are 4 times higher than females. Intentional injuries homicide was 2.5 deaths per 100,000. Blacks were higher than whites, and females were lower than males. National data show people about 180,000 or more per year die from injuries and violence, and about 1 in 10 endures a non-life-threatening injuries but require a hospital emergency department treatment. Number 6 is obesity. 61.5% of Seminole adults were overweight or obese in 2007 and jumped 64.8% in 2010. 26% of adults were obese. The rate of adults who limited their activity due to physical, mental, or emotional issues jumped from 14.4% in 2007 to 21.8% in 2010. Communicable disease syphilis cases up to 6.2 to 6.2 per 100,000 in 2013 from 4.7 in 2012. Chlamydia rate up to 321.0 in 2009 from 166.4 in 2008. Gonorrhea rate was steady at 71.2 in 2013. HIV/AIDS rate upped to 14.6 in 2013 from 9.1 in 2012. 233 patients were with HIV in Seminole County in 2013. National data show about 19 million new STD infections developed per year, and about half of them are ages from 15 to 24. Global communication issues. The top 10 global community issues are focusing on increasing role of frontline health provider, the cumulative demanding of community health provider, the reawakening of family planning, assisting longer life of children, AIDS, fighting to ground zero, the ongoing combat against malaria, exterminating polio, the global liability of non-communicable diseases, safety for health providers during battles, and portable health and new technologies.